Thank you for joining us today. This is our last session. It's hard to believe, but this is the seventh in our 7 session series on the trajectory of telehealth post-COVID. And we're really excited today to have Art Cooksey, who's the founder and CEO of Let's Talk Interactive based in Charlotte, North Carolina. And really looking forward to hearing from Art today. It's an exciting time in the world of telehealth and healthcare delivery in general. If you've been following the news, you know that on March the 17th, Amazon announced their national rollout of Amazon Care, which provides both telehealth and in-home care across the country. May the 6th, Walmart announced that they were buying MeMD. And then yesterday, there was the announcement that Mayo Clinic and Kaiser Permanente were making major investments in medically home. So lots happening in the telehealth arena, the general healthcare delivery arena. Hopefully this series has built a foundation for you in terms of the industry, both what leading healthcare providers are doing, as well as some of the innovative telehealth companies like Let's Talk Interactive that we're hearing from today. If you're interested in an even deeper dive, later this summer, we're going to be kicking off a telehealth academy. There'll be an 8-week cohort-based program where we will come out of the program with a roadmap for your organization going forward, kind of stepping back and thinking strategically and where you will be headed with telehealth. So if you're interested in participating in that, please reach out to us and we'd love to talk to you more about that particular program. We've really appreciated all of the presenters, and I really need to say thank you to Steve Amon, who kicked the program off from Mayo Clinic, that was involved in the announcement yesterday. Nick Desai, co-founder of HEAL, Julie Stover with Envision Healthcare, Bruce Brandeis with Teladoc Health, Michelle Griffith and Amber Humphrey, both with Vanderbilt University Medical Center, and then last week, Blake McKinney. It has been quite a lineup. And Art, you will have the chance to close it out today. So we're looking forward to a great session. Art Cooksey is chairman and CEO of Let's Talk Interactive. He founded the company in 2001. So Art, you've been at this quite some time, a real veteran of the telehealth industry. It was founded to provide consumers with access to qualified and licensed behavioral health professionals, which then he later evolved to customized services and telehealth technology. And the platform is having major impact in the Florida Panhandle through a program called Hope for Healing Initiative. It's placed telehealth kiosks in 63 schools throughout the region, and now 60,000 students have access to mental health support. Art's also been leading collaboration in addition to schools with the correctional institutions and providing growth in that area as well. Prior to Let's Talk Interactive, Art held corporate and strategic roles for over a decade, including leading corporate development with Bank America Merchant Services. So Art's experience both outside of healthcare as well as in healthcare, specifically in telehealth. And Art, looking forward to your presentation to our participants. Remember to put your questions in the chat, and we'll have some time at the end of the session for Q&A. So Art, it is all yours.
Okay, great. Well, first I want to, thank you for the opportunity to join this series, and I've had the opportunity to see most of the presenters, and they've done such a phenomenal job. So, thank you for that. And I'm just going to shut my email down because I just seem to be getting a bunch of them. So thanks for the opportunity again to join. And LTI has been around for a while. It's been around since actually before 2000. So I came from the communications industry, and I owned a telephone company out in Southern California. And my mother was the head of a national nonprofit organization that really worked with abused children. So there was such a demand for mental health services that I picked up on just supporting her and her organization, that I started looking into mental health and telehealth in like the late 90s. I thought, gosh, this is a wide open market. Of course, I was coming from telecommunications where I had T1s and I had high-speed internet, and I was pretty used to using video conferencing in my daily life. And the rest of the world was still on dial-up. So there was a big disconnect in technology. And as we started to develop the company out in 2001, we really had the opportunity to build up our first product, which was for mental health services, and that was Let's Talk Counseling. So we built out a platform that allowed mental health providers to connect with patients, to schedule, to really take into account PHI and just the HIPAA piece of it, even though that was really early on. And I partnered with a couple of experts in the field back around 2000, and that was Dr. John Bloom and Dr. Gary Waltz. And I believe both of them at one point were presidents of the American Counseling Association. But Dr. Waltz was at the North Carolina Greensboro School for Mental Health Services or counseling, or class counseling services. And they really took the time to talk through what the challenges and the barriers and their opinions were for providing mental health and healthcare services. And they'd written a book called Cyber Counseling in 2000. So their minds were in the right place. They just didn't really understand how to bridge the technology to service gap. And that's where we started. So we built that platform out. And then we started looking into building out other pieces. So for our renewed investment in 2016. So as we developed the Let's Talk Counseling platform, we realized we were just so far ahead of the infrastructure for mental health services and for healthcare services. So we went back into development in 2016. And it was really after being contacted by a hedge fund that renewed our interest, saying, that this is coming. People are really getting excited about telehealth, even though there's such a big lull in the marketplace for such a long time. So, we got back in, we started making reinvestments, and we came out with a whole new product line in 2018, specifically for the individual providers. And we started developing out those accessory pieces like telestroke and pulse ox and EKG and dermoscopes and otoscopes, and tying them into kiosks and med carts. And really, in my opinion, and I thought about it, and it's kind of like when Bill Gates started Microsoft and IBM, and you had these two separate vehicles to drive adoption, and they married very nicely. But then Steve Jobs came along and created Apple, and he married the hardware and the software together. So we were in the process of that in 2018. We're really starting to figure out that there is a major need to marry these, because it was very is cluttered. It was not an easy process to roll through. So as we rolled into 2019, we had done 6 jails in Florida and really brought in mental health services and intake evaluations, but also assisted with their medicated assisted treatment programs. So it was our real first launch of the telehealth med carts attached to the different peripherals to tie into a hospital system, where there was just a huge opioid problem in this panhandle area we were servicing. So there was some press around this, and the First Lady, Casey DeSantis, saw this press release or the news article, and she contacted us and said, listen, we want kiosks, mental health kiosks, we want portals in every school in Florida. Well, that wasn't something that could be done quickly, but 63 schools throughout the panhandle, there were funds available there from Hurricane Michael. These kids were suffering. There was a backlog of over 300 children that had not seen mental health professionals. The servicing company for mental health providers was 2 hours away. So it was a 4-hour round trip to see these kids, or the parents had to bring the children to Tallahassee, which was quite a distance. So as we were looking through their workflows and everything that happened there. We successfully did the implementation, and then COVID hits. And in 2020, we'd gone from a world of this is how telehealth works, doing white papers, really explaining that telehealth is not snake oil. And all of a sudden COVID hits and the pendulum swings, and there's this amazing need for telehealth services. And people they're not quite sure how it works, but they know they've got to have it, and they're jumping to it as quickly as they can. So COVID really spurred a telehealth awareness and movement, and it spurred a lot of financial investment in technology to help with that growth and that movement. So as the COVID hit and the licensing started to relax for the providers, you started to see some reimbursement, Medicaid, which is driving adoption, right? Because there's now financial reciprocity in providing the services, and it really made remote healthcare sessions possible. And I think one of the things that was said earlier on from one of the speakers was that the adoption of healthcare has been kind of a reactive thing at this point, where, let's react to a problem with telehealth. But I really believe telehealth and marrying in some of the hardware devices and having an infrastructure that can tie into EHRs, EMRs, and really do some digital tracking is a way that is really going to change the way we do healthcare in the future. So super excited about seeing the adoption, the fruit that healthcare truly does have to bear. And so as we start looking at forward thinking and realize that, telehealth is beyond one size that fits all. Every person has a different condition. That's why there's a lot of the DNA sampling that's going on to really take medicine from a practice to a science, and understand that you can't just throw something in a population and roll it backwards until it works. And I think that's where telehealth is. You're seeing the larger organizations that have a lot of money to investing in their specific infrastructure to serve their specific clients. But there's a lot of organizations that don't have a lot of money, and they're trying to figure it out. And even the ones that do have a lot of money are trying to figure it out. And they're realizing now that they're probably 12 months to 24 months out from really deploying something that's been gone through good quality control testing, and that the technology, there's just a lot of moving parts. So it's fun to see a lot of people get into telehealth and starting to think about the future of telehealth. It's really moving this industry forward quickly. And it's also very rewarding to have been there a long time before it actually happened. And so I'm getting to see it and realize it. So that's a lot of fun as well. So, one of the things that really makes LTI special in the telehealth marketplace is our custom web services and development. So at the end of the day, LTI is a development company. We build these portals, we build access points, we're into secure development. We're on the GSA schedule, so we can service government groups. So we've invested a lot of time in developing the talent to build our infrastructure and other people's infrastructures for them in a very secure way. We also have developed out our EMRs or our APIs to develop into EMRs and EHRs to do a single sign-on. So, and all of our products are white labeled. So it really allows our customers to jump ahead when it comes to development of their products. And then as they have unique use cases, we're never selling something that's a box. So we're not trying to make a healthcare system or a group fit into what we consider the right workflow for their patients. We develop around their workflow for their patients. So it makes the software very fluid and very nimble and very quick to change. And we have different versions. Some are more for enterprise versions, some are more for a quick service turnaround type of version. So we've married them all together. So it's a lot of fun with the custom development because it's always new ideas, it's new thoughts. And it's always problem, no problem. We can figure it out. There's always a solution for everything we're doing. One of the things we found out as LTI was growing, we never took on big capitalizations. So we built the company in a way that we were structured to take on capital. But as the market just never grabbed, I just didn't feel comfortable taking the company down that path too early. So we bootstrapped it. We grew based on our net profits and our revenues. And one of the areas we realized early on was that there's a big gap in provider networks. So we went out, we built a network of over 29,000 providers across the country. So we have access to everything from psychiatrists, which really I feel like are almost the mythical unicorns of healthcare at this point. There's just a very deplenishing group, and not many people are going to school to become psychiatrists. And then you've got everything to nurse pracs, and primary care physicians and everything in between. And we've got this network to where we can send them out boots on the ground to people, or we can provide the services through a telehealth service. So that has really helped us bridge the gap to make our software available, to make our hardware available. And then the need for the provider has just been overwhelming. So it's been a big piece for us in growth, and really helping our networks and partners we consider have the resources and the providers they need to service those populations. And as we look at our software solutions, we've got really sophisticated software, and it's ranging from a bunch of different use cases, everything from providing the analytics that the providers need to do their CPT billings and the codes, to SOAP notes, to tying into EHRs, EMRs, to we're starting to release some AI that will help with billing and help with leading the patient to the proper provider. And then we're also developing some pieces into blockchain now. So we see that as a great way to conduct a transaction and keep it extremely safe and secure. So we're, very focused on what our patient's PHI is and how to protect their information and stay cutting edge. Because at the end of the day, we're a development company. So this is our bread and butter. So we've got to really have the best product on the marketplace. And I feel like we're doing that. So the virtual clinics, the live analytics, we have secure consent forms. We've got patient-facing scheduling, patient co-pays, recordings for CPTs. So there's a lot of different use cases to develop within the software product. And we're just so proud of what we have done here in the US building this product out. When we transition into hardware and marrying those products together, that's where we have the ability to really tie in that Microsoft theory and the Apple theory and bring our kiosks and our med carts and our rugged telehealth kits to market, tying in the ability to push the analytics, the dermoscopes, the otoscopes, all the way out to telestroke. Your glucometers, your EKGs, pulse ox, all of those are pretty much standard in a package to send out information to the provider so they can read it live and they can record it and integrate it into the patient's electronic records. So that's a really exciting piece of the hardware integration. And that wouldn't have happened if we wouldn't have had really taken a focus of marrying hardware and software together and coming up with a complete telehealth solution that can service patients no matter where they're at and in any use case. So as we started to look at the adoption of telehealth, and and COVID really drove a lot of that telehealth adoption, we've seen significant growth throughout not only the adoption, the networks, the utilization, the need to develop custom portals, the need to grow into different EMRs. You've got these weights out there, Cerner, Epic, that have been in the space for a long time, but they've been slow to adopt in some of these areas. So developing the APIs to work in, integrate into their EHRs and EMRs, just because they have such a physical presence in the marketplace, makes this adoption very simple for a larger organization to instantly drive a HIPAA compliant telehealth solution out there that really checks all the boxes when it comes to patient health information, HIPAA, billing and CPT codes, and providing quality care, quite frankly. So those are some of the things that have been driving the adoption. Of course, COVID has really driven rapid growth, but there's some other things, and those are some things we were missing early on for LTI, and that's smartphones, your Wi-Fi networks. I'm really excited about what Elon Musk is doing with Starlink, and we're using Cradle Points now in our rapid deployment kits, so they can sync into a satellite type of system or any kind of Wi-Fi system for emergency management systems. But what Elon Musk is doing with Starlink is he's going to make broadband available to everyone. There's a lot of money out there through the FCC. Everyone's trying to lay fiber, but this is going to come from the sky. And it's got, from what I understand, 50 to 150 megs down, 50 megs up, with like a less than 20-second millisecond latency. So just a lot of tech terms there, but most people's cable internet's not that fast. So think about the tribes and all these remote areas that telehealth has just not ever been an option. And we're going to instantly impact them in the very near future, because Starlink's in beta now and it's being rolled out. But telehealth services are now going to go places that, quite frankly, just never had access to telehealth and have really needed to have access for a long time. So as we see LTI is a bridge. So we're really a bridge between our our providers and their customers, and we're a bridge between how they conduct business, how they transact telemedicine, how they deploy it, how they train, how they create portals, how they really provide the best care possible through innovation and through utilization. There's back when we first started, there were these PMPM models, per member per month models, and they were all based on low utilization. Well, that was never too exciting for me, because I wanted to build something that people use. I wasn't trying to build something to make money. Well, I want to make money, absolutely, but I really wanted utilization. So with telehealth, we're seeing a high utilization. So you're seeing customers, if they have the option, and if it's simple, and if they trust it, they're going to use it. And now you can bill for it, and you can eliminate those missed appointments. You can create better care. You can have more touch points. Now you can drive in some home health pieces for remote patient monitoring within your senior facilities. There's a lot going on there. So just bridging the connectivity. So I really view LTI as like AT&T of the day. We're connecting people through a quality service that they can trust. When it comes to integration is such an important part of making all of this come together. And that's where our development company comes in part, and really in play, is the fact that we can integrate these pieces. And if you come to us and you talk to us about integrating something that we've never integrated before, we'll figure it out and we'll integrate it. So, there's a lot to be said about being able to nimbly customize a product, run it through quality testing, and put it to market, and have a secure platform that's just ready to go. And it fills a need. And that need doesn't need to be a specific need, because we can evolve the need anywhere within healthcare, which is always a really exciting piece. When we think about configuration and a customizable line of med carts, kiosks, these rugged telemedicine kits that can open up, they're in a Pelican case, they roll in, they can connect to a satellite, they've got all the peripherals built in. We can put solar panels on them that charge them in 6 hours for 12 hours of use. So really talking, and this rugged telemedicine kit I'm talking about, for example, is also used on Air Force One. So we're talking about some really good equipment that's easily deployed, and it's built specifically for telehealth. So you're not going to have to fumble around and try to figure out how to customize it. And everything we do and everything we build is US based. So we're not depending on containers and things like that to get our products in. We're working with our manufacturers here in the United States, which means we're spending a little bit more money, but that's okay, because we really have great relationships with our manufacturers, and they've become partners in helping deploy a national telehealth system, which is so critically needed at this point, and it's exciting just to be a part of. So as we look to the path to success, evolving LTI is focused on development, deploying facilities, responsive growth, strategic growth, investing our money for the future, seeing where the system is today, but really having a good feel for where the system is going, where it needs to go, and making sure that we're making those investments today, even if we're looking 24, 36 months out, rather than to try to catch up 24, 36 months out. So it's an exciting time to really have a strategic plan and to go through these strategy sessions, taking input from all different areas and building as part of that roadmap or that part of that strategy that you have going forward. So when you get started with LTI, we try to keep it simple. We go through a needs assessment or scoping sessions. We really want to understand what our customers need, what their use cases are, what their patient demographics are, what the bandwidth even looks like in these facilities. And then we adopt in our communication platform. So there's currently 4 HIPAA streams out there, and Zoom's being one of them, WebRTC, VC, and video. So LTI has made the decision to build our platform to wrap into these platforms. So, at this point, we're able to conduct business with 3 of the 4 HIPAA streams and layer in the secure documents, layer in the secure scheduling, layer in the SOAP notes, the AI, the blockchain technology, tying in for CPT codes, billing, all of that stuff layered into that video stream that we can lock down on our servers as well. And then we look at what's needed for medical devices, equipment for these facilities. Is it just a software thing that they just need to really grant access to their patients? Or do they want to go full scale, like Tennessee Health Management Services, the 108 facility locations, and we've serviced 28 of the 108 so far. We're planning to service the other 80, but we put in the med carts that are tied into all the peripherals. We've got the soft packs for quick deployment, but it really helps develop in this remote access to qualified doctors and tying in the analytics that they need so much. And then we look at, is there any web development that's needed? Do we need to create custom portals? Are there APIs to integrate in? If so, how deep does the provider network need to develop into the API? So, a lot of questions there, and that's all covered really in that needs assessment and scoping session. And once we've started building everything and we've got it ready to deploy, we go through some significant training, which is all virtual. It's ongoing. We have video training to support that. So we really spend a lot of time to make sure that our providers understand how to use the system. I know the LTI system is now being used for a national mental health certification for mental health or telehealth mental health services. So it's great to see our system being used for the foundation for some of these services. And then, obviously support for anything you do is critical. And I know as well as I do, there's some companies that are really good at it and some aren't. So we've built in a 24-hour call center, US based. They're generally answering the call within about 10 to 15 seconds. So we've really made it easy to engage our support teams with any issues that may come up. And, mostly we find these as simple like connectivity issues on the customer side, and we can help them vet that piece out as well. So it's fun having a group of people that really understand the product, that are just sitting there waiting for the phone to ring. And the less it rings, I guess, the better job we're doing. But it's also an opportunity to really make sure that we're providing the right training so that we can mitigate the amount of times our customers need to reach out for help. So as you look at some of the products we use that we deploy, we've got the kiosks, we've got the rugged kits, we've got the telemedicine carts. We've integrated into all of these things. So it's a simple line of products. We can pretty much integrate into any hardware. We're device and browser agnostic. But as you get into very specific and specified needs, you're going to need to utilize tools like this, and we can integrate our software into these tools to make it a seamless integration to tie into the patient records. We are enabling our providers to provide telehealth custom solutions to their patients. We're enabling our providers to provide a better service. We're enabling our providers to have a new way to grow their revenue streams for their companies. So tying in some of these remote providers really fills a need, helps grow a gap very, very quickly. When we do bring in the outside networks, generally they go to work just like they would normally for the network that's hiring them, so that network can bill for their time and those CPT codes. But just enabling our providers to connect with their patients simply, safely, and securely. So that's one of the fun things. And then, we're really transforming patient care, and that's innovation, but it's evolution. It's something that's just not going to stop. We're going to continue to innovate. We're going to continue to grow. Last year, LTI won the Zoom inaugural Trailblazer Award for global innovation, which I was very excited about. And it was an honor because we were able to take that Zoom stream and build on it. And we have access as a software developer kit into the stream. So we can go in and we can make modifications and we can simplify things. And then we can integrate in the different applications and pieces and hardware so that everything is just one simple solution. We're working with that with WebRTC and the other HIPAA streams. So it doesn't matter really what stream you're on. We have all the rest of the connection platforms that's needed. And that's the reason I love doing this business, is because it's never trying to sell boxes and ribbons. Everything that we do is a custom box and it's a custom set of ribbons. And we know at the end of the day, the outcome and the impact is to service people within healthcare, mental health care. And the marriage of mental health and healthcare is so exciting to see today, because it's been a massive gap, in my opinion, and they are truly coming together. And now we can tie in the assessments for the mental health piece to tie into the to the healthcare piece, which as everyone on this call probably realizes now, mental health shows itself physically sometimes and vice versa. So as we really start to look at healthcare as a science as opposed to a practice, it goes in line with providing better patient care. And with that, I'll open it up for questions and answers.
Thanks, Art. That's really informative. Congratulations on the Zoom Award. That's quite an honor and a comprehensive offering that you've described. I want to start with a question that kind of relates to what I talked about at the beginning in terms of what's happening with announcements around telehealth, the Amazon announcement, the Walmart announcement, and then the announcement yesterday by Mayo and Kaiser Permanente. If you are, and this goes to an assignment that I referenced for the Telehealth Academy that will be starting, say that you are just a small hospital system and you're thinking about your telehealth offerings and what you're doing in telehealth and care delivery. Think about, or if you were in the role, if you described for a small hospital system their vision for telehealth, healthcare delivery in a 3-year time frame, besides the vision that they would buy the services of Let's Talk Interactive, what would that vision look like? What do you see there, that small healthcare hospital system vision looking like in 3 years?
So, there would be a lot of questions that I would start off with within the scoping session. First would be, what does your broadband look like to the citizens in your area? What's the radius? How rural are you? What does your broadband look like within the healthcare facility that you're talking about itself today? And I would start there because that gives us a good foundation. And then I would start to stream it out, and I would start to find out what the demographics are as far as eco or economic for the area, what the common mental health issues, if there's substance abuse issues for the area. So really want to understand what the field of battle looks like, if you will. And once we have a full picture of that, then we look at it like eating an elephant, one bite at a time. We start to break this out, and we go, okay, if you need infrastructure, let's lay in infrastructure. Let's hit that. If we need to enable the citizens, let's make sure that they have access points in places that have infrastructure. So that may be libraries, maybe schools.
So Art, I'm sorry to interrupt, we just have limited time. If instead of the process, I'm thinking about what will their telehealth and care delivery model actually look like? Say it's in Charlotte, North Carolina. So you're in a metro area, which would answer some of the questions that you're raising. What is care delivery in 3 years in a small hospital system? What is it going to look like? I mean, we're talking about the telehealth interactions with physicians. We're looking at remote monitoring, hospital at home, all of those factors that are going to mature fairly quickly over the next 3 years. So if you were a reporter visiting the health system and writing an article for Modern Healthcare or Becker's or someone, what would that description look like?
So I would see the ideal health system, and that's the perfect group to go after, is a group that's starting from literally scratch. I would see the ideal health system as something where the people in the area know how to access and schedule the system. They have access to be able to pick their providers, even though they may be states away, or if it's very specialized, it could be in a different country, if they had access to that. A system where from the provider side, they're able to triage patients remotely. They're able to track their records. They're able to bill CPT codes. They're able to provide the services. They're able to provide an ER room, if you will, so they can triage remotely and bring people in or let them stay home if there's a pandemic. It's taking into account any gaps you have in broadband and making sure there are access points readily available to those patients. But I see the barriers in broadband eliminating in the next probably 12 months or less. So I think those are the things that from the healthcare system they should be excited about, because now they can service these patients. That, if they need a dermatologist that they can't afford to have on staff at this place, they can leverage one from another system. So now they're paying out the CPT code and saving, I don't know, whatever they're saving.
Okay. Let me build on the question and ask it in this way. So you're a bricks and mortar healthcare provider. In 3 years, how much is what is happening now and what we're seeing beginning to really accelerate going to affect your business, your healthcare delivery, your model of what you're doing?
That's a great question, Phil. And it brings to mind Kodak, Blockbuster, some companies that didn't adapt to the marketplace. Some companies that BlackBerry is one that really got hammered. So I think it's adopt or die. If you don't learn how to better service your patients with the technology that's available today, shame on you. Probably it's time to change out the CEO. But I really think that this is a reasonable and an excellent way to not only solve this gap issue for provider coverage, but also to provide care for people that have not had access to it in the past and probably have gone without, rather than to fumble around to get the care they didn't really know was available. So it's a huge opportunity for these networks to really redefine themselves and stand themselves up as a technology hub or center to service their customers rather than a dying system.
Yeah, and I think you're right. And what you're describing is it's a real opportunity for healthcare providers. There's tremendous threat, obviously, from the new entrants, but it also presents tremendous opportunities. Steve, if you want to unmute, if you have a question for Art, I will pause and let you do that.
Well, just really quickly, when we talk about disruptive innovation, we often talk about three criteria. One is it more accessible? A second is it more affordable? And the third is it simpler? And you've actually touched on answering each of those three during your presentation. But what I would like you to address is what is the quality of healthcare when you have integrated telehealth? Is telehealth it's better because it's available, but the care delivery is not necessarily as good as in person? How do you address those questions?
Yeah, so I truly believe in my heart, Steve, and thanks for that question, that the quality of healthcare goes up. Anytime you can have access to a healthcare professional to answer a question, your quality of care just went up. There's a big marketplace out there for these primary care physicians to have a private practice. People are willing to pay them out of pocket on a monthly basis so they have direct access to a primary care physician. Because sometimes I feel like you're just lost in the shuffle. You know, you'll go in, you'll meet with someone, you bounce around from here to there, and a lot of that can be handled through the telehealth piece. So when you just start with the intake, you know, there's huge value there. Then as you move into what Phil was alluding to with the remote patient monitoring, you know, diabetes, there's some people out there that are cancer patients and AIDS patients. When you start thinking about mental health and substance abuse and incarceration, you know, honestly, these people go into jail with a substance abuse or mental health issue, and they leave with the same issue. And there's really not a lot of follow-up aftercare, and that's why the recidivism rate is so high. So it's a pretty simple problem. It's just very complex, and it takes some organization and some money to put behind it. And it takes really identifying what the problem is. And that, Steve, I believe is what telehealth is going to do for the industry. Is it's just going to make healthcare more accessible, which instantly improves the quality of care.
So Art, one final question, and that is, as you think about over the next year or a couple of years, what do you see as most exciting development coming out of telehealth and impact on patient care over the next year or two?
Well, the adoption is incredible, but there's still a massive segment of the population that truly don't have access to telehealth. So I see that access being granted and that adoption shortly following. I see people having access to mental health services that was certainly a need before COVID, and it's been a need for the last 20 years, as far as I know. But it's more of a need now, and I think integrating telehealth, mental health services, everything's healthcare together, and I think you're going to see more of that over the next couple of years. I think you're going to see people leveraging healthcare services through remote patient monitoring and telehealth, and you're going to see these senior facilities where there's always been this gap access point for the kids who have an older parent that's in a facility that may be a state or two away, and now to have an access to be part of that care. Because I'm sure, you know, if you leave someone in the hospital alone, they may not get the quality of care they would if their child or their spouse was standing right there, you know, examining everything that happens. And I think we can integrate a lot of that care in to bring the families in to be part of their parents, their children, their grandchildren's healthcare or grandparents' healthcare. So I think people are going to evolve to embrace healthcare more. And it's, you know, healthcare is cradle to grave, right? And we've got people out there that are doing a lot of things that they don't know are bad for themselves, or, you know, and they're not having the proper education. And I believe that this technology and the better communication between healthcare and the patient is going to start driving some of these changes that are going to impact us in the future in a quality way versus our reactive strategy right now.
Art, thank you so much. It really is an exciting time in healthcare, and so much is happening. It's moving so quickly. It's just, I can't think of a more exciting time to be in this business. I want to say thank you on behalf of Steve and myself for everyone who's participated, the presenters. Have been great sessions, and for those of you who have been with us live as the sessions are ongoing or watched on video, thank you for joining us in this, and we look forward to seeing you in a future program. Thanks for being involved, and we will see you soon.
Thank you so much.